guys, this is my second attempt at my second video. My phone decided to go dark on me, so hopefully this one works out better. I'll try to make it maybe a little quicker. First things first, this is my second journal entry for my Tummy Tuck diary. I want to go over a few things with you guys, just in general. Make sure this is something that you want to do. Make sure that you're not doing it for anyone else. I think that would be pretty miserable if you went through all of this to try to impress someone else or to maybe change their views on you. I know peer pressure or pressure from your family or whatever can be rough, but if you are comfortable in your own body, I wouldn't let someone else change your mind about you. That being said, if you are uncomfortable with your body and there is not another option as far as non-surgical or maybe, you know, less invasive surgical options. I mean, if you don't have those options and you've tried working out and you've tried dieting, and this is something that you really want to do, then go for it. But make sure you are careful. There's a lot to consider, and it again is a very serious procedure. I've researched it for about 6 months. I'm not going to put every single thing that I've researched into this video or we would be here for quite a while. So if you do end up with questions or comments or concerns, just put them down below. I will do my very best to answer them promptly. What I am going to go over though is how I went about finding a doctor and why I like my doctor. So just what I think a person should look for, and I know what was important to me when I was looking for the right doctor for me. There are a lot of plastic surgeons out there. There are a lot of options. You can go out of country. I don't recommend that. It just doesn't make sense to me that you would go out of country because you have a very short time to recover and then you come back to wherever you live. And if something goes wrong, you know, you might go back to this doctor and you might not even, I mean, it's going to be painful. What if, you know, a week after your surgery, you're trying to get on a plane or come up with the extra money after you've spent all this money to get on a plane, and maybe he doesn't even cover the follow-up visit, or maybe that doctor's office is gone now, you know, and it's just, to me, that would be very scary. I want to know that I'm in good hands, and I want to know that I can see that doctor, so that kind of thing. Just be careful. I wouldn't go to a doctor just because they're cheaper. I saw a lot of deals when I was shopping around for a doctor, you know, and some of these guys are offering $4,000, and then you look at their before and afters and they're just spectacular, and then you look a little closer and you go, wait a minute, that kind of looks like it could be airbrushing, and then you research and you find out, and then you look at the reviews and you go, oh, it was airbrushing. There are a lot of complaints about this doctor and lawsuits, so be very careful not to freak you guys out and just be thorough. There are a lot of things that you can ask. I mean, you're gonna know whether or not you're in a professional environment when you walk in most of the time. Pretty much what you want to ask, the big questions, just safety questions, is he or she board certified? How do they conduct the procedure? What are their techniques? Do they have, I guess, an artist's point of view about it at all too? Because I think a plastic surgeon, especially with something like a tummy tuck, you want them to not just do it according to the book. You want it to look right for you, and everybody's body is a little different. So you want to make sure that they enjoy what they do, as far as, you know, making sure that you're going to look good for you. Let me see here. I wrote a few things down so I wouldn't forget. When you go to your consultation, when I finally decided what doctors I wanted to go to for consultations, I actually had a few. I only ended up going to the one because I was just so pleased with him. I ended up actually having 2 consultations with the same doctor just because I had so many questions and a lot of nerves, and I'm very particular that way. So when I went in, it was a very professional office. That impressed me. I went in with a friend just so I had an extra set of ears and eyes and an extra opinion from someone that was there. I think it's a good idea to bring someone that you know and trust with you, whether it's family or friend. I did bring a list of questions, which I have here. I'm going to go ahead and read you just a couple of the initial questions that I asked the doctor. And I wouldn't worry I mean, obviously I don't want to be rude, but I wouldn't worry too much about how they're going to feel about you, because really this is about how you feel about them. I wouldn't be worried about walking out if you are uncomfortable with that doctor. Maybe they're rude. Maybe you don't like the nursing staff. All the people that you're meeting, you've got to realize are going to be taking part in your surgery and recovery. So if you're not comfortable, I would just get out of there. I mean, whether or not I don't care how bad you want it. If you're not comfortable in that situation, don't put yourself through it. There are plenty of doctors out there. You'll find something that fits you. But these are the questions that I asked, or at least a few of them. There were more pages. I can only find one. Credentials. You want to ask maybe what college your doctor went to, what affiliations he has, with what hospitals, where he did his medical internship, what kind of surgical procedures he's authorized to do, where's the operating room going to be? Is it in the same facility that you're going for your consultation, or is it going to be at a hospital? I mean, I think most doctors probably go through the hospital. Mine does have a board certified OR in his actual office, so it's kind of one-stop shop for me. But, you know, I can't say that I would object, you know, if my doctor said we do it in the hospital and all that, because, hey, then you have nurses watching you, and, you know, you could really do it either way. But let's see what the cost is. I think it's important to ask how many post-op visits you have. You don't want to go and get this done and then all of a sudden any follow-up you do costs money. Generally, I think that's a sign that you do not have a good physician or surgeon. So make sure that they're willing and able to give you as many follow-up visits as you require. Up to a year. My surgeon does 2 years. And then also another big point that you want to touch on is revisions. If something goes wrong, how's it handled? Are you just out of luck and you have to figure it out, or see another doctor, or pay him again, or what? I mean, it's a serious topic, because maybe your scar doesn't heal the way you want and now you're embarrassed about your stomach again. I mean, that's what you're doing this for, is, you know, your desired outcome. So if something besides your desired outcome becomes your result, what do you do? Well, I was comfortable with my doctor's policy on it. As far as he's concerned, if it is something that just happens in the healing process, maybe the scar doesn't look right and you need scar revision, that's completely free of cost to the patient. You know, if something were to go wrong and he had to go back in and maybe repair something or fix something, maybe a stitch gets pulled, maybe, you know, whatever it may be, he covers that. I think that's important, because you never know what could happen. You never know how your body's going to heal or react to the surgery. And I think that's very, very important. I can't stress it enough. Now, on the other hand, I wouldn't be surprised if your doctor says, well, that depends. If it's something that you did, it may not be fully covered. Or if it's something that's neither party's fault, but, you know, you're not happy with, then maybe it'll be half and half cost. So definitely bring it up with your doctor. As long as you're comfortable with his answer, you're fine. I would definitely say steer away from any doctor that does not promise you or put in writing that he will handle any, you know, basic revisions, because I don't think that that's a smart or a safe route to go. So that's just my opinion. Another questions I asked him were, how soon can I get back to work? How long till I could work out? Obviously, how long till I can get in a bikini? And different ways to manage pain, and different ways to, you know, hide or cover up a scar. Not that I'm not worried about a scar, but again, I am a dancer. It's not why I'm getting this done, but obviously, when I do return to work, it'll only be a month after. My scars will be very noticeable. So for that particular purpose, I would definitely need to hide them. There's a few products he suggested for that. But all in all, I was told you can expect to be out of work for about 2 weeks. Obviously, your results are going to vary, but not just because of your own personal healing. It depends on what your job is. If you have to lift or move things around, it's going to be longer. your muscles are going to be sutured. So don't expect to just be doing everything you used to do in a couple of weeks. It's going to take time. You might be able to return to work after 2 weeks, but you might be on a restricted duty, or, not be able to pick up and move, things over 5 or 10 pounds, which you would be surprised how many things are over 5 or 10 pounds. For me, I'm just going to go ahead and take an entire month off. I've saved up for it because I just don't want to risk anything. The longer my body has to recover before I have to go back to work, the better. So I'm looking forward actually to the time off work, but definitely things you want to consider. So be careful when you pick your doctor. If you're not comfortable with them, find a different one, even if it takes more time. I feel like it's better to spend more money and take your time than to end up with a doctor and you're stuck with this guy who maybe doesn't do a good job, and then it was all for nothing. So be mindful, be careful. Hopefully I covered everything you guys, really need to know. If there's anything that you want me to touch on specifically, go ahead and leave it in the comments below. If you don't have anything nice to say, don't say anything at all. But no, feel free to ask. Any questions or comments are welcome. So thank you, and let me know what you guys think.